We'll also introduce you to Thomas John, the CEO of Plutus, a Dallas-based revenue cycle company that focuses on applying RPA capabilities all across the industry. His company has its origins in autism services, but also advises a much wider array of healthcare companies as well. I think it's time for us to get started, a bit more about who Plutus is. Maybe you can also transition to our next question and tell us a little bit about what products today Plutus is finding in most demand, and then we'll pass it on to Aaron to answer the same question.
Good morning, everybody. Hopefully you can hear me loud and clear. So my name is Thomas John. I'm the founder and CEO of Plutus Health. We're a Dallas-based revenue cycle management company. We pride ourselves as a tech-enabled RCM company, primarily because we use a lot of RPA and automation in our billing process. But the topic of the day is behavioral health, and we started about 15 years ago as a regular RCM company working in multiple specialties across the spectrum. But in about 5 years ago, we came across an opportunity to help autism therapy clinic in Los Angeles, actually, that wanted us to help them with some of their AR. And that kind of opened up a very interesting door for us into the behavioral health space. Since then, we have not looked back, and about 40% of our business today is around behavioral health, autism therapy, mental health, and so on. And we're about a roughly 800 employee company. We support about 800 providers in the market, both behavioral and non-behavioral health. And we, our go-to-market strategy has been to work predominantly with, emerging, private equity-backed ABA therapy companies, or autism therapy companies as they're called. And what we found there is that even though there are a lot of principles of RCM that we could apply from the regular medical billing industry, there were a lot of complexities in the process. For example, prior authorization was a very complex issue because of the time involved in providing therapies across multiple years for these young children that are autistic. The other challenge that we run into is the behavioral health benefits are not very clearly defined many a time within various insurance plans. Another challenge we found in the business is that the payer policies, whether it is related to CPT codes, whether it is related to what is reimbursable, is varied across multiple payers in multiple states, sometimes within the same payer across different plans. So it's a fairly complex situation when it comes to reimbursement inside of in this space. So we decided that this was a great opportunity for a company like us with some backing in technology and some automation to be able to apply those capabilities into the marketplace. So we built certain rules and rules engines that helps us do the billing, pre-billing audits, and authorizations, and make it more effective for our customers. So the second question that Jonathan asked was about what are some of the solutions that customers in our industry are looking for, or our specialties are looking for. One of the biggest challenges I've seen is denials. I mean, just like in any other specialty, but it has its own unique aspects, like denials related to credentialing. So one of the things you would know is that I think 1 out of every 36 kids in the United States has been diagnosed with autism. So the challenge there is there's a huge demand and a big wait list in most of these clinics, but there are not enough therapists, there are not enough people to provide these services. So there's a huge demand for therapists, which means there's a huge turnover, which means there is always a backlog in credentialing, which means there are a lot of credentialing denials. So that started off as one area where we started building some technology to create rosters that we can use to check whether a particular therapist can see a particular child based on their insurance coverage, and then be able to provide those services. Another area that we found a huge challenge, was in the area of, for some of our largest customers, private equity backed, have, hundreds of thousands of claims, and getting claim status was a big challenge for them. So we built some claim status automation in order to reduce the time it takes for us to figure out whether a claim is paid or not, because most of these claims are low value, and we had to have some technology to do it. So I would say these are some of the big ones that I would project as opportunities in this space. Thanks.
I'd really have to echo everything that was just mentioned. I think on the substance use and on the primary mental health side, we see exactly the same things, and the demand from our target market is very much the same. These providers are looking for more automation. They're looking for mechanisms to reduce claims denials. They're looking for more insight around verification, eligibility, primacy, and really, I'd say probably where we're seeing the most demand right now is in clinical documentation education, because not only do the payers have different guidelines as it with coding and CPT codes and revenue codes and the type of claim forms, but they also have different guidelines in what actually substantiates a service or level of care. So the way that Blue Cross defines residential treatment for somebody suffering from an opioid diagnosis is not the same way that Optum defines residential treatment for the same service. So we see there is a huge demand for us to go into the facilities and really educate providers on what constitutes that intensity of service and also the medical necessity. I'd say the second area where we're seeing a huge demand is for new treatments that are showing tremendous clinical outcomes for the treatment of mental health diagnoses. We're seeing a lot of demand around ketamine therapies, transcranial magnetic stimulation, and then by and large, and I think this isn't going anywhere, but continuous reimbursement services for MAT, for medication-assisted treatment.
This is great, and I'd like to shift the panel discussion to why these companies are making so much of an impact on their clients. Maybe we can talk a little bit about some case studies or experiences you've had that show the difference that you're making in these companies and across the industry.
Thank you, Jonathan, again. So how are we making a difference today? I would say industry expertise is the first differentiator. So the fact that we focus on certain specialties like autism therapy, mental health billing, allows us to create a certain level of expertise that is unique to that particular specialty. Now, with that comes the ability to scale. In our case, because again, a lot of growth in this marketplace. Whether that is mental health therapy, whether that's behavioral health or ABA therapy, the growth has been tremendous. Now, that growth has already brought in private equity investment and money that allows these companies to consolidate, creating scale. That scale creates its own complexity, and that complexity needs some kind of technology-based solution, and that's what we have brought to the table in order to differentiate ourselves from the marketplace. So essentially, I would say two things: the vertical knowledge or the specialty knowledge, and the automation and technology are the two differentiators that we bring to our customers, to our marketplace.
What a great question. I think, our USP really involves our data. So we have now cultivated such a broad data set on what reimbursement trends and payer trends look like across the country that when you have this data, we are able to kind of flip the script and score the payers on how their reimbursements are stacking against each other. So we can show that for an adolescent psychiatric service in Malibu is being reimbursed the same way that an adolescent psych service in Murfreesboro, Tennessee. That's some really telling information when you consider the difference in the cost of delivering those services. So I'd say our reimbursement data and our benchmarks that we've been able to establish for reimbursements, propensity of denials, these types of things, then utilizing technology and AI to really comb through this data and to drive predictions. I think that's probably the biggest differentiator today.
With these two observations, I'm curious what else you're seeing out in the field in behavioral health revenue cycle, the capabilities, the differentiated solutions that you think could be very disruptive in the future.
So one of the observations that I had early on as we started focusing on behavioral health is that it is so archaic and primitive compared to the insurance payer processes or policies, and everything is at least about 10 years behind. So the opportunity is definitely coming in and bringing those best practices, whether those are pre-billing audits, it's denial management, it is technology even the EMR software, the practice management software that is available in these markets are pretty rudimentary. A lot of them are clinical solutions that overgrow into becoming practice management solutions and billing solutions. So there's not enough, even best practices inside the software. So I think that's a big opportunity that we see for a player to come in and bring those best practices, those technology solutions, those expertise that you may have derived by helping a large health system or a large customer in the hospital world, and you could pretty much apply some of those to this industry is my sense of it.
I would say, one of the areas where we see that there's opportunity for tremendous disruption would really be in the ability to use artificial intelligence to measure the propensity for a successful treatment outcome. So one of the challenges with behavioral health, especially in the adult population, is being able to keep the patient engaged after discharge, to measure how is the patient doing after they leave the facility. We can easily measure progress while somebody is in treatment, but when they leave treatment is when the rubber really hits the road. With new technologies for patient engagement, we can better keep those patients engaged. With better patient engagement, we can measure outcomes. With those outcomes, we really have the opportunity to disrupt the way the whole health system is reimbursing for services, and I think we can really make more progress in moving the needle toward value-based care. So I would say, we anticipate market disruption in terms of utilizing technology, wearable devices, and AI to track patient outcomes and to facilitate patient engagement.
So I was just told that we have 5 more minutes, and I want to ask a question which we didn't prepare for, but I think it's going to be also very helpful. I'm curious, when you receive a call from a new prospective client in the behavioral health industry, can you walk us through what you're often seeing, maybe the most common challenge that your clients across behavioral health are struggling with, and what kind of solutions you're able to offer?
So I would say with the population that we work with, about 90% of the calls that we receive are the same. The operators that we work with typically are being driven by a mission of advocacy and a mission of helping people get better. And they tend to they're calling because there's a crisis. There's an emotional reaction. The dollars that are in the bank account are not matching what their expectation would be given the services that they see are being rendered in their facility. And really, they're calling us to diagnose where that disconnect is. We can audit their claims. We can see if it's a denial issue. Is it a coding issue? Is it a billing issue? Is it an eligibility issue or an authorizations issue? Is it a process issue because there's too much fragmentation? So by and large, I would say the phone calls are always pretty much the same. It's a founder, an operator, or a PE fund that's backing a facility, and they say, we are so busy. We've never been this busy before. We have a waiting list. Our beds are all full, but our reimbursements are dropping. Can you please help us figure out what the origin of that problem is?
I would echo everything that Erin said here. So typically when we get a call, it is a crisis. There are 2 types of customers that call us, right? One is the crisis customers, and the other is somebody who is planning for growth and wanting to scale and has the wherewithal to do all of that and needs a good partner who can consult them on best practices and technology and processes. But let me talk about the first one, the crisis customers. So typically, as Erin suggested, they're very busy, they're growing, but there's no money in the bank, or there's not enough money in the bank. Usually because they don't have good visibility into their AR, into their denials, into the problems that are caused inside the RCM process, especially in the front end. We talked about credentialing problems, we talk about prior authorization issues, eligibility issues, benefits issues. So one area that I want to call out is benefits. So the problem in the behavioral health space is that, unlike in the traditional healthcare RCM world, where you could use technology to ping through a clearinghouse or through a payer or a third-party service and get download your benefits, and you can decide what you want to do with that benefits, whether it is to provide services or not. Here, you'll have to make a phone call, and many a time, if it's a small practice and they are not able to make that phone call, they make the wrong judgment that this particular patient is covered, and then these are therapy services that are going to run for months. So by the time you get your first claim denied, you've already lost a lot of money in the process. So that's a typical challenge that I see out there, and that triggers many other issues downstream, and practices end up losing a ton of money, and that's all going from their pocket, because they have to pay therapists, they have to pay salaries, and so a lot of my customers have seen that they're growing as a business from a being busy, hiring more people, bringing more patients into the door, but not in terms of cash flow. So we come in and try to help them with cash flow. So that's what we see today.
I think that we're at the end of our time. I want to thank Thomas and Aaron for sharing some of their insights. I think it is fascinating as what we've heard them talk about are some of the most foundational elements of the revenue cycle, ensuring that your providers are credentialed, understanding your denials, but applying a deep understanding of what's happening within their provider setting. The specialization in behavioral health clearly is a major differentiator, and it sounds like companies positioned like Onsite, like Plutus, are going to thrive for a long time. So thank you very much, everyone, for your time.